Good morning. Today I will discuss the skeletal system activity 2.
This is the lateral view of our skull. The first structure here is what we call as the coronal suture. The coronal suture is located between the frontal and parietal bones. The parietal bones are located or formed in the part of the side and top of the head. So this is the parietal bones. Next is our temporal bones, which is located part of the side and base of the skull. So this orange one here is what we call the temporal bone. The lambdoid suture is located in the superior border of the occipital bone and the posterior borders on the right and left parietal bones. This here is what we call as the squamous suture, and it is between the temporal and parietal bones bilaterally. This is the occipital bone, which is located at the back part of the base of the cranium. This structure right here is what we call as the zygomatic process, and it is located in the temporal bone and is a long arch process projecting from the lower part of the squamous portion of the temporal bone. This part right here is what we call as the external acoustic meatus, and it is located in the ear canal. This part right here is what we call as the mastoid process, and it is located each side of the head and just below and behind the ear. This structure right here is what we call as the styloid process, and it is located laterally in front of the jugular process on the inferior surface of the temporal bone. This structure here is what we call as the mandibular ramus, and it is located in the inferior to the maxilla. This is the frontal bone, and we all know that the frontal bone is located in our forehead. Next is our sphenoid bone, and the sphenoid bone is located in the middle of the skull towards the front. Next, we have here this structure is the ethmoid bone, and it is located in the center of the skull between the eye. Next is the lacrimal bone, which is the yellow-green one here, and it is located in the eye socket. Next, we have the nasal bone, and it is located in the center of the nasal canal, placed side by side at the middle and upper part of the face. Next, this bone is what we call as the zygomatic bone, and it is located at the widest part of our cheeks. These two right here is what we call as the maxilla, and it is located in the upper bone of our jaw. This part below in both of the upper of our teeth is what we call as the alveolar processes, and it is located on the jaw bones, which holds our teeth. So you can see here that it holds our teeth. Next is the mandible, and it is located inferior or below to the maxilla. Lastly, the mental foramen is located on the anterior surface of the mandible. So this is the anterior view of our skull, and the first bone structure I will describe is right here. This is the coronal suture, which is located in between the frontal and parietal bones. So this is the coronal suture, which is located in the frontal and parietal bones of the skull. Next is the parietal bone, and this is the parietal bone, the green one, and it is located side and top of the head. Next, we have nasal bone, and it is located in our mid-face, but we can also state that it is located in our nose. Next is our sphenoid bone, and it is located in this is the sphenoid bone. It is located in the middle of the skull towards the front. And this bone is the ethmoid bone, this color orange one, and it is located in the center of the skull between our eyes. This yellow-green colored bone structure here is the lacrimal bone, and it is located in our eye socket. This blue colored bone here is what we call the zygomatic bone, and it is located at the widest part of the cheek in our skull. And what we have, this color purple bone here is the maxilla, and it is located in your upper jaw. So this is our maxilla, and you can see here this color pink, I think. Yes, this is where we can find the maxilla in our upper jaw. Next is this. This is the mandible, and it is located in the inferior to the maxilla. So it is below the maxilla. Next, we have here the frontal bone, this color yellowed one, which is located at the center of our forehead, or the bony part of our forehead. This is our frontal bone. The superior orbital is this black one here, and it is located in our fissure greater wing of the sphenoid. This colored black one here, between the sphenoid. Next is the temporal bone, this color orange one, and it is located in the part of the side and base of the skull. This is the sphenoid bone, this orange one. The optic canal is located in the lesser wing of the sphenoid bone near the base. So this is our optic canal. You can see here there's a little circle. This is where our optic canal is. And we have also here the middle nasal concha, or the ethmoid bone of the medial surface of the labyrinth of ethmoid. That is where it is located, at the medial surface of the labyrinth of ethmoid. This green colored bone structure here is the inferior nasal concha, or the lateral wall of the nasal cavity. That is the location of the inferior nasal concha, in the lateral wall of the nasal cavity. This one here. The vomer is the center of the nasal cavity. So vomer is very easy to identify because it is located at the center of our nasal cavity. Lastly, the alveolar processes, and it is located on the jaw bones which holds the teeth. So both of these two are the alveolar processes. The anterior and posterior view of our femur, or what we call the thigh bone. So the first structure here is the neck, and it is located below the femoral head. And this is the femoral head, which is located at the highest part of the thigh bone. Next is this structure. This structure is called the intertrochanteric line, and it is located on the anterior aspect of the junction of the femoral neck and shaft. Below the anterior view of the femur, we have the lateral condyle. This is the lateral condyle, and it is located in the lower extremities of the femur. Next, this is the partellar surface, and it is located at the front part of the lower end of the femur. Next is these two structures here is what we called as the lesser trochanter. It is located from the lower and back part of the base of the neck. And this structure here is what we called as the gluteal tuberosity. The gluteal tuberosity is located at the posterior surface of the femur. And at the posterior lower part, we have this part is the intercondylar fossa, and it is located at the medial and lateral epicondyle of the femur, this part. And this part also is called the medial condyle, and it is located in the medial or inner portion of the upper extremity of the tibia. This is the tibia in this part right here. Let's go back to the upper part, and this part is what we called as the greater trochanter, and it is located at the ridge at the top of the femur. This part here, this part is called the intertrochanteric crest, and it is the posterior aspect of the junction between the femoral neck and shaft. Lastly, we have this part. This part is called the lateral condyle, and it is the lateral portion of the upper extremity of tibia. That is where the lateral condyle is located. And as you can see, this part is the tibia. This is the anterior and posterior view of our humerus. The first structure here is what we call as the greater tubercle. It is located in the proximal end of our humerus. And this structure right here is called the lesser tubercle. It is located in the anatomical neck, below the anatomical neck. This one right here is what we call as the deltoid tuberosity, and it is located in the middle of the humerus. Below here is the radial fossa. It is located above the front part of the capitulum. This part right here is what we call as the coronoid fossa, and it is located superior to the trochlea. This is what they call capitulum. It is located in the lateral portion of the distal articular surface of the humerus. Both of these structures are the head, and it is located between the shoulder joint and the elbow joint. This is the anatomical neck. So in the anatomical neck, it's located inferior to the head of the humerus. This structure right here is the interbacular sulcus, and it is located inferior to the lesser tubercle. This is the radial groove. And it is located center of the lateral border of the humerus bone. This also here is what we call the deltoid tuberosity, and it is located proximally about a third of the way to the elbow. So you can see here, this is the deltoid tuberosity. Below here are what we call as the medial epicondyle. Both of these are the medial epicondyle, and it is located in the distal end of the humerus. These spike-like structures here are what we call as the trochlea, and it is located in the surface of the elbow. This ring-like structure like here is what we call as the surgical neck, and it is located inferior to the tubercles where the shaft begins. Next, below this is the olecranon fossa, and it is superior to the trochlea. Lastly is the lateral epicondyle. It is located in the distal end of the humerus. So here it is. So this is the anterior view of our hands. So this is the phalanges, or what we call as finger. It is composed of the distal, middle, and the proximal. The distal is located at the tips of the finger. The middle is obviously located in the middle row of the finger bones, and the proximal is located at the bottom of the finger. This is the metacarpals. It is also called as a palm, and it is located in the bone proximal to the thumb. This is what we call as the carpals, and the carpals is composed of the hamate. This is the hamate, which is located in the distal row of the carpal bones on the medial side of the wrist. Next is the pisiform, and it is located in the side of the wrist in the proximal row of the carpal bones. This one right here is what we call as the triquetrum. In the triquetrum, it's located in the middle side of the wrist. The lunate, this is the lunate, and it is located within the proximal row of the carpal bones. The ulna is located in the medial forearm. This bone structure right here is what we call the trapezium, and it is located beneath the thumb joint. Next here is what we call as the trapezoid, and in the trapezoid, it is located in the distal row of the carpal bones. This one right here is what we call as the scaphoid, and in the scaphoid, it is located in the thumb side of the wrist. And this one right here in the middle is what we call as the capitate center, and it is located in the carpal bone region. Lastly is the radius. So this is the radius, and the radius is located in the thumb side of the forearm.
And that ends my presentation. Thank you.